The U.S. legally upholds the United Nations Convention Against Torture and Other Cruel, Inhuman, or Degrading Treatment or Punishment, and a Harvard Law School project on disability report. When does mental coercion constitute torture? Notes: institutional mental health settings, such as state-run psychiatric hospitals, routinely employ coercive forms of treatment that includes non-consensual treatments and the administration of chemical restraints and prolonged application of mechanical restraints. African Americans, Indigenous, and people of color are overrepresented in psychiatric facilities and put at greater risk of coercive mental health practices. Involuntary hospitalizations are estimated to account for 54% of admissions to psychiatric inpatient settings. This leads to forced psychotropic drugs and electroshock treatment that can cause memory loss and brain damage. Black patients labeled with a mental disorder and presented to hospital emergency departments across the U.S. are 63% more likely to receive chemical restraints than their white counterparts. African Americans are overrepresented in restraint-related deaths, accounting for 22% of studied deaths, while comprising only 13% of the U.S. population. The report on forced psychiatry and psychiatric abuse against African Americans states, the mental health system as a system of social control is intricately linked to racism, and the U.S. should prohibit mental health commitment and forced treatment, which have a discriminatory impact on people of color. In 2021, the World Health Organization issued guidelines for mental health treatment that condemned coercive practices being used, despite the significant evidence that they lead to physical and psychological harm, and even death, and urged eliminating the use of coercive practices in mental health settings. The UN Committee Against Torture called for an absolute ban on all coercive and non-consensual measures, including forced treatment, which constitutes torture, in all places of deprivation of liberty, including psychiatric and social care institutions. The UN Human Rights Commissioner has called for forced mental health institutionalization and treatment to be replaced with rights-based and decision-making mental health services.